Hello everyone, my name is Mohamed Rashid from Action Against Hunger, Somalia Counter Office, and I'm pleased to share a pilot study conducted in Somalia and Niger. The study aimed to generate evidence on the use of the Faircap filters at point of use for household water treatment in complex humanitarian emergencies. The efficacy of the Faircap filter was well demonstrated in laboratory setting. The project was implemented in partnership with two local actors, Edgar in Niger and Juba Foundation in Somalia. In regards to the humanitarian outlook, the security situation in both countries remains fragile, and there is high displacement trend that was observed. Additionally, there is inactive crisis of cholera outbreak in both countries. The study had three line objective. The first was to measure the performance, acceptance, and also the comparative advantage of the Faircap filter against the chlorine-based water treatment. The second one was to assess the potential for collaboration and partnerships between the Faircap developers and the local stakeholders to enhance the effectiveness of the technology and also its reach. The third was to learn about the factors affecting the adoption of the Faircap filter and its use in emergency context. The study utilized two versions of the Faircap filter, one with the silicone pump and the other with the tap. And in terms of the features of the Faircap, this is a filter that's designed to be a small, robust, easy to use, a low-cost, effective water purification device, and it has a membrane pore size of 0.1 micrometer. In terms of the lightness, the kit is designed to be light enough so that it can be transported, especially during the emergencies in the humanitarian setup, and it can also be locally installed by the community volunteers. In terms of the overview of the study had two arms, the Faircap group and the chlorine-based water treatment group. Both groups were provided with the kits, the Faircap filters, and the chlorine-based water treatment. And for the Faircap filter specifically, training of Action Against Hunger and the partner staffs were conducted by the Faircap manufacturers to understand the use and the maintenance of the filters, so that the community volunteers are able to undertake the installation and also the assembly of the filters. Routine household visits were conducted and data was collected using the M-Water platform. Jointly with the Ministry of Energy and Water Resource, water quality analysis was conducted both for the Faircap households and the chlorine-based water treatment households. The study monitored different matrices from products effectiveness, use acceptability, and also the product's quality. On the effectiveness, this was in terms of measuring the percentage of water analysis meeting the sphere standard, both for fecal coliforms and also the turbidity levels. The water samples collected from the filter intervention households were less likely to show elevated levels of fecal coliforms and turbidity compared to samples collected from the chlorination tap intervention households, and this was recorded in the results that were undertaken. For Somalia, it was at 95% of the water analyzed meeting the sphere standard. Similar case for Niger, 95% also for household using the Faircap. The results were a bit lower for households using chlorine-based, 50% for Somalia and 66% for Niger. On the turbidity levels, there were significant changes in terms of the effectiveness of the Faircap in regards to turbidity, 92% for households using Faircap and 94% for households using Faircap meeting the sphere standard. The numbers were lower for the chlorine-based water treatment, since chlorination is not effective, especially when the turbidity levels are higher. On the user acceptability, the numbers were 72% for Somalia and also 94.4% of the households preferring the use of the filter over the aquatap. In terms of the product's quality, we had envisaged less than 10% of the Faircap filter to have anomalies in terms of breakage and also the leakage. And we have noted 6.6% for Somalia, 5.2% for Niger, still lower than the threshold that was earlier envisaged. And particularly for the two versions of the Faircap, we have seen more anomalies common with the Faircap with the silicone hand pump and the filter with the tap was more effective than the filter with the silicone pump. In terms of cost effectiveness, the project finds suggestive evidence that the Faircap family filter may be more cost effective than the chlorination-based interventions. And this is due to the data in the different scenarios for scenario 1, scenario 2, and scenario 3. Scenario 1 is a bit higher for Somalia, and this is attributed due to the cost of trainings, the assembling, and also the transportation cost. But for the rest of the other scenarios, scenario 2 and scenario 3, as well as all the scenarios for Niger, the Faircap family filter is more cost effective. And in comparison with other existing filters in the market, we have also observed that the Faircap family filter is cost effective. Actually, the cost is 5 times less than other existing filters in the market. And also it is capacity to purify water, especially a reduction around the turbidity levels of the water. And given that most of these communities are also reliant on riverine water, and this is effective in terms of its capacity to eliminate turbidity levels. On what we will do differently if we were to do the study, improve the logistical planning. The project required rigorous logistical planning, especially on the supply chain, since the Faircap filters were shipped from overseas. And then the numbers were a bit high for the Faircap, and selecting a reasonable number of beneficiary households, I think will have been ideal in order to undertake a more effective monitoring of the targeted households. Finally, the project will also have benefited from by assessing the pre-existing water treatment at community level, for example, understanding if the existing infrastructure, water infrastructures, were pre-chlorinated at source level in order to rule out bias of the study. The project has also recorded a number of challenges, and the first one was the lead time in terms of the delivery of the Faircap, since the filters were shipped from overseas, and the inability to also source these filters from the local manufacturers was a bit of a challenge. Then the aspect of the maintenance of the filters. Some filters had anomalies, and it wasn't possible to maintain those filters, given that there was inavailability of spare parts in both Niger and in Somalia. Finally, due to the instability in both countries, some of the beneficiary households were difficult to trace, especially for the chlorine products, due to the security situation in the countries. With the positive results observed, there is need to advocate for the inclusion of the Faircap filter into the wash cluster core pipeline, and they need to also create linkages with private service providers at country levels for communities to access their products in the local markets. Due to the strong user preference, there is also need to create advocacy and also dissemination exercises at cluster level and also at community level. Finally, there is need to gather more data to precisely estimate the lifespan of the Faircap filter. Finally, I want to take the opportunity to thank the Emergency Environmental Health Forum organizers and our donors for enabling us to undertake this study. And if there are any questions or comments, myself, Nuru from our Niger country office and Edgar from our HQ Spain are ready for any comments or clarifications. Thank you and God bless.